We are now on the post-operative phase, which is the last phase of the perioperative nursing. So the post-operative phase begins when the patient's transfer to the recovery unit or the PACO and ends with return to an optimal level of functioning. The post-operative period may be brief or extensive and most commonly includes a period of time following discharge from the surgical facility. Okay, so again, the post-operative phase begins with the patient's transfer to the RR or the PACO and ends with the return to an optimal level of functioning. The perioperative nurse must provide complete and concise information when transferring the patient to the post-op caregiver. Most surgical patients go to the surgery into the PACU. Any information that can assist the post-op caregiver in customizing interventions to meet the patient's specific needs should be included in the hand-off report. So that's why you do health teachings, di ba, before masulod ang patient sa OR, and you need to tell again the patient and the caregiver about the health teachings again. Okay. Critically ill patients may be transferred immediately to the ICU following surgery. So, naiuban special cases, no, uh, dili na kailangan ihatod og pako, but diretso na sa ICU. For example, it's like mga craniotomy, or mga spine surgeries, diretso ginasala sa ICU. In this case, the perioperative nurse may not provide care beyond the intraoperative phase. The circulating nurse must advise the ICU as soon as possible of the plan to transfer the patient immediately following the procedure and make the necessary arrangement. For example, i-arrange pa ang bed, ang transport personnel, the mga orderlies, portable oxygen, and monitoring equipment for a safe and efficient patient transfer. Depending upon the complexity of the surgery, ambulatory surgery uh, patients may be nearly ready for discharge when admitted to the PACO. In an effort to better utilize the nursing resources and increase efficiency, particularly in smaller hospitals and in ambulatory surgery, many perioperative nurses assume responsibility for providing care in both the operating room and in the PACO. Care at home, if required, is provided by a family or other primary caregivers. That's why health teachings is very important. Nursing activities in the immediate post-operative phase center on support of the patient's physiologic systems. In the later stages of recovery, much of the focus is on reinforcing the essential information that the patient and other caregivers require in preparation for the discharge. We have the post-op assessment. So A for airway, B for breathing, C for circulatory, C for consciousness as well, S, safety or comfort, D, dressing, drainage and drugs, E, elimination, F for fluids and foods. And then we have the Aldrich scoring. Okay, so the five physiological parameters are activity, respiration, circulation, consciousness, and the color. So the Aldrich scoring system is commonly used scale for determining whether the patient can be safely discharged from the PACO or recovery room to the ward, or pwede na siya ma-discharge from the hospital if same-day procedure and discharge siya pwede sa patient. Okay, so we have the Alderets scoring. We have the area of assessment, muscle activity, so able to move all extremities, ability to move two extremities, or unable to control any extremities. So, na point score diri. So, within 1 hour, pila man siya. 2 baka ha, or 1, or 0, then within 2 hours, and then 3 hours. Respiration, so ability to breathe deeply and cough right after sa surgery. Mahimo baka na siya sa patient. Limited respiratory effort, or no spontaneous effort at all. So, butan din within 1, 2, or 3 hours. Next, we have the circulation. So, BP, um, plus or negative 20% of pre-anesthetic level. Sa second is 20 to 40% of pre-anesthetic level. Or sa zero nga score is positive or negative 50% nga pre-anesthetic level. So, dili sa circulation, meaning kanang ang anesthetic nga medications is murag napabitaw sa body sa patient kung wala pa siya na totally nawala. Okay? And then sa consciousness level, fully awake ba, arousal on calling, or not responding at all. Then the O2 saturation, so unable to maintain O2 sat of more than 92% on room air, needs O2 inhalation to maintain O2 sat less than 90%, I mean more than 90%, or O2 sat more than 90% even with O2 supplement. Then required for discharge from PACO is, ang score dapat is between 7 to 8. So this is an example of the recovery room record. Now that we have again obtained from previous workplace. So we have here the name, the age, sex, and the room number, operation performed, anesthesia technique, the diagnosis, the surgeons, anesthesiologist, and then the recovery room nurse, and then the date. So we have here the monitoring. So ang hospital protocol before namo is every 15 minutes mi diri mag-record. So magkuha mi og autosat, and then, kung naka-O2 ba siya, then pila yung BP, pulse, respiratory temperature, every 15 minutes. And sa output pod, if, for example, naka-polybag catheter ang patient, then yung IVF, diri, sa level, sa iyahang IV nga solution. Okay, if nabay mga attachments pod, if ang na-blood transfusion, okay, so naka-monitor sa na siya din he. And then, position, like airway, position niya spinal supine rather, supine. Then oral right up, nasal left up, tube head up, obstruct feet up. Okay, so check lang na siya din ha. Then we have the scoring, so area of assessment. So dito gyapon is naka based sa ALDRET scoring. So we have the point score dere, and then the areas of assessment. So respiration, sa circulation, consciousness level, okay, the color, so wala siya na-appeal dito, no? So, ilahang specify diri sa ilahang form. So, the color is for number point score 2. So, normal skin color and appearance, altered skin color, baka or naka-pale, dusky, blotchy, or jaundiced. Then, frank cyanosis. Okay, so muna siyang ki-add nila din he. Then muscle activity, so naaman ni siya, able to move extremities. So after that, so butang din upon admission sa PACO, then pagka 1 hour, 2 hours, and then 3 hours. So after that, i-total day na siya. So dapat between 7 to 8 ang ALDRET score, aya siya ma-discharge or ma-out sa PACO and mahatod balik sa iyahang room sa patient. Okay. Then, po diri sensorium, respiration, airway. So, and then the latest vital signs diri sa recovery room nurse, and then ang urine output. Muna yung indoors ito sa station ward nurse. So, this is an example of your ALDRET scoring. So, depende na sa inyo ang hospital on how they modified the ALDRET scoring sa ilahang PACO or recovery room nga unit. Okay, so respiratory status during post-op assessments. So you have the RR, respiratory rate, rhythm, and depth, patency of airway, presence of oral airway, breath sounds niya, i-assess ninyo, use of accessory muscles, okay, skin color, ability to cough, ABGs if applicable, then O2 saturation. Then the intervention. So you position the patient on side to prevent aspiration, okay? Either left or either side para makaginhawa og tarong ang patient. Then you suction artificial airways and oral cavity as necessary. Necessary lang, no? ask the patient to perform respiratory exercises. So, you breathe in and breathe out together with the patient para musunod ang patient sa inyo ha kung saon og pagtarong og ginhawa og lalom. Then, administer O2 as needed. Then, circulatory status. So, you assess the heart rate, the blood pressure, the skin color, the heart sounds, peripheral pulses, the capillary refill of your patients, okay? Then, edema, skin temperature, and the urine output. And then, you check for Homan sign, if naa, changes in vital signs, symbolizing shock. Then, type, amount, color, odor, and character of drainage from the tubes, drains, catheters, or incision. Then if naa, you notify the surgeon immediately. So the interventions, you check under the patient for pooling of blood. Okay, so basi na yung nagdugo din ha, no, somewhere post-operatively sa site. So you check it. And then underneath it pod, kay basi na swimming pool dito sa blood sa patient. Then you check the dressings, the tubings, the drains, and catheters for any blood or any other discoloration. Then monitor changes in heart rate and blood pressure. Then if there are any abnormalities, you report to the surgeon and to the anesthesiologist as well. Next, thermoregulatory status. So, assessment. You need to check the temperature and you need to check if the patient is shivering. So, the intervention is you apply warm blankets. Okay, or bear hugger if nasa inyong hospital. CNS status. So, assessment. You check for the level of consciousness, the mental status, the movement and sensation in extremities. Okay, so inyo ng patient, ma'am, makalihok ba mo sa inyong kamot? Left, right, or sir, malihok ba niyo mo imong tiil? Left and right. Okay, then presence of gag and corneal reflexes. Interventions, you orient the patient to PACO environment. Okay, so you tell your patient nga, ma'am, sir, naana ka din sa PACO or recovery room. Diri sa ka magstay, ma'am, stabilize ka na mo, aya ka na mo ibalik sa imuhang room. No, bahalag tulog pa na ang patient, bahalag drowsy pa na ang patient. You tell your patient na na-transfer na siya sa PACO or recovery room. Then protect the eyes if corneal reflex is absent. Then you protect the airway if gag reflex is absent. Then you tell your surgeon or your anesthesiologist regarding the abnormalities that you have just found. Then also for the wound status, so you have the types of wound healing, like first, secondary, and the third intention. Okay, so you study again the types of wound healing. Okay, yun na siyang naagian. Then classification of surgical wounds. So first, we have the clean wound. So no break in sterile technique during the procedure. Second, clean. So contaminated wound. Minor break in sterile technique. Alimentary, respiratory, genitourinary tract, or oropharyngeal cavity not entered. Then third one, contaminated wound. So open, fresh traumatic wound of less than 4 hours duration. And then gross contamination from the GI tract. Dirty and infected wounds, for example, old traumatic wound for more than 4 hours from dirty source or with retained necrotic tissue, foreign body, or fecal contamination. So, kana gid siya is infected na gid na siya. Kaya na may mga foreign materials or foreign na mga substances nga nakasulod sa wound. Then common post-op orders, for example, NPO until fully alert, then ice chips as tolerated, advanced diet as tolerated as well. Then suction, PRN, complete current IV line or consume, then discontinue if patient tolerating fluids. Okay. Then compazine, 5 milligrams PRN for nausea and vomiting. Morphine sulfate, 10 milligrams IM every 3 to 4 hours PRN. So that is just an example of common post-operative orders. Wound care. So commonly used wound dressings. So ni mga OS na ay tape, sterile tape, sterile strips. Clear na siya, no? Na-brand ana, they call it Tegaderm. Kay it's a clear like plastic sheet nga pang-cover siya sa wound. This is nice because dali siya kanang maklaro bitaw na wala siya natabunan gid ang site. So if there are any infections, mga phlebitis or kanang any mga infections, so dali ra siya makita. So if ever nga nagpula siya or any other discoloration, so dali ra siya ma-identify. So that is very nice. Muna na siyang ginagamit karon sa mostly sa halos hospitals kaning Tegaderm. Kaning clear nga dressing sheet. Okay. Okay, so the strips of tape should be placed at the ends of the dressing and must be sufficiently long and wide to secure the dressings. The tape should adhere to intact skin. So in letter A, this is the proper way of uh, putting the dressing and the tape as well, or the bandage. Okay, so as you can see, same level ra siya ang tape sa edges. Okay, so muna siya dapat secured na siya pagkabutang. Unlike sa letter B, so in letter B, too narrow and long ang first one. The second is too short. Okay, third one, too wide. Okay, so pangit kayo na siya. Again, nursing is an art. So, dapat good creative mo when doing the dressing. Okay? Or nurses know how to put this one properly. Actually. Then, we have an example of wound drainage. So, here, safety pin keeps the drain from slipping into the wound. So, we have this drain sponge. So, I think morning kung na mga for colostomy. And then, the second picture na ay drain. I think this is a Jackson Pratt drain. Then third one is another drain. Here's a leg. I think this is a hemovac. Okay, if I'm not mistaken. So these are examples of your drains. Kung gina-drain or salo niya ang mga excess ng mga blood sa surgical site. Okay, para dili dito magpundo ang mga dugo. Okay, diya siya magawa sa drainage, sa drain. And then wound irrigation. Okay, so they can use a sterile nga syringe. And then this is an open wound, so hugasan na siya using a NSS or any sterile solution sa inyong solution operating room. Using isaluon din siya sa kidney basin. Of course, the nurse should wear a sterile gloves. Kay this one are sterile and this one also. Okay? Para po dili mo maka-contaminate sa wound sa patient if you are using non-sterile nga gloves and non-sterile syringes as well. So this is how you irrigate the wound. Kibali ginalimpyuhan ninyo ang wound nung mura siya ginahugasan but in a sterile way and using sterile items. So types of dressing, we have dry to dry. So trap necrotic debris and exudates. Wet to dry, softens the debris as it dries. Wet to damp, so medyo basa siya gamay. Wound debridement or debridement, but we read this as debridement. Then wet to wet, moisture dilute exudates. So those are the types of dressings. Then assessment of dressing. So warmth, swelling, tenderness, or pain around the incision. That you should take note also of the type, the amount, the color, the odor, and character of the drainage on the dressing. If nagi abnormalities gani, if baho siya or grabe ang bleeding or lahi yung color, green na bakaha, then you report directly to the surgeon. Amount, consistency, and then color of the drainage. Dependent areas, for example, underneath the patient. So, i-check yan ninyo. Then drains and tubes, and be sure that they are intact, patterned, and properly connected to the drainage system. Then interventions, reinforce dressings as necessary. So, you reapply the dressing. Then we have the urinary status. So, assessment. You need to check for bladder distension. Okay, if kanang dako ba yung bladdering area. And then you check for the amount, the color, the odor, and character of urine from the Foley catheter if present. But if wala, you check the diaper of the patient. Interventions. Catheterize if necessary. Then notify the MD if urinary output is less than 30 cc per hour. So meaning if less than 30 cc per hour, so there is something wrong with the like sa urine sa patient. So maybe there's an obstruction sa yung urinary system. So that's why you need to inform the doctor immediately. Next, gastrointestinal status. So assessment. Abdominal distension baka, nausea and vomiting, bowel sounds, passage of flatus. Okay, so if nakautot bang patient, so passing of gas after your surgery is very important. So if you cannot pass gas or if di ka makautot soon after the surgery, it may mean that post-operative ileus or gastric delay is happening. So a post-op ileus is when there's a slowdown in your body's ability to digest food. So that's why good as much as possible ipauntag makautot na ang patient right after sa surgery. Or even if makasulod na siya sa ward, dapat makautod tapod ang patient. Then you type the amount, the color, the odor, and character of the drainage from the nasogastric tube if present. Then fluid and electrolyte balance. So assessment the intake and output, color and appearance of the mucous membranes. Then skin turgor, tenting and the texture. The status of the intravenous line. Then type the amount, color, odor, and character of the drainage from the tubes, drains, catheters, and the incision. Then type the amount of solution, flow rate, and the tubing infusion site. Then post-op complications is we have the wound infection. So predisposing factors, for example, if you have or the patient has diabetes, uremia, obesity, malnutrition, and if the patient is having a corticosteroid therapy. So the major clinical manifestations are fever, foul smelling, greenish white drainage from wound. So meaning any infection gid no, and persistent edema and redness as well. Treatment, so antibiotics on basis of wound culture and sensitivity, preventive nursing interventions, then strict aseptic technique in the operating room, uh, and during post-operative dressing changes. So as much as possible, no, atuging malikayan ang SSI or surgical site infection. So naay blood and serum no nga combination nga drainage from the wound, then sensation that something gave or let go. So nalik murag kalit ni gawas or ni open. Treatment, lay the patient down, cover wound with sterile, saline, soak, gauze, or towel. Okay, again, it should be sterile, then saline soak. Dapat basa siya. Gauze or OS or towels. Okay, then prepare to return patient to the operating room for repair. So, diretso gina siya isulod sa operating room para matahi siya diretso. Then, monitor for shock. Preventive nursing intervention. So, splint wound when the patient coughs is splint. Medicate for nausea and vomiting. Highest risk during 5th or 8th post-operative days. So, teach the patient the signs and symptoms as they may already be discharged. So, again, highest risk is during the 5th to 8th nga post-op day sa patient. So this is the difference between a dehiscence and evisceration. So wound dehiscence is a surgery complication where the incision, a cut made during a surgical procedure, reopens. So muna siyang dehiscence. Mag-open ang gitahi. It is sometimes called wound breakdown, wound disruption, or wound separation. Okay, so there is a cut, reopens. Then evisceration is a rare but severe surgical complication where the surgical incision opens or nagdescends and the abdominal organs then protrude or come out of the incision. Munang evisceration. So, as you can see in the picture, sa letter B, no, nag-protrude ang part sa iyahang abdomen. So, evisceration is an emergency and should be treated as such. So, again, isulod din sila directly sa operating room. So, example of wound dehiscence and evisceration. So, part nga nag-open din nag-eviscerate, then this part also. So, dako magud kayo ang patient, no? So, murag wala na kaya sa suture, if gi-suture man gani na siya. Okay, another post-op complications. We have elevated temperature. Predisposing factors are infection, dehydration, response to stress and trauma, prolonged hypotension, transfusion reaction, respiratory congestion, and thrombophlebitis. So major clinical manifestations are the temperature elevated above 37.5 degrees Celsius, elevated pulse and respiratory rates, diaphoresis, so grabe ang singot, and then lethargic ang patient. So, elevated temperature, common post-op complication ni siya sa post-op patients. Then treatment, so antipyretics, give paracetamol as ordered, cooling sponge baths or TSB, and then increase the fluids as ordered. Then urinary retention, okay, major clinical manifestations, little or no output or frequent small amounts only. So that's why you have to monitor the output of the patient. Palpably distended bladder, restlessness, and discomfort. So the treatment, measures to promote voiding, like privacy, running water, then sitting the patient up, then catheterization if above methods fail. So of course, if kaya sa patient, no, so ipa-ihi lang siya, then ipa-on ang running water, no, okay, to promote maka-urinate siya, and then sitting patient up. Preventive measures, adequate hydration as ordered. If okay ra, no, if wala contraindications, then early ambulation. And then next is urinary tract infection or UTI. Major clinical manifestations, mild fever, dysuria, hematuria, and malaise. Treatment, adequate hydration if not contraindicated, maintenance of good bladder drainage, then antibiotics on basis of urine culture and sensitivity. So preventive nursing interventions, encourage fluid intake, again if not contraindicated, early ambulation, and then avoid catheterization or remove it within 2 days. Okay, again, depende ni siya sa doctor's order if i-catheter ang patient or not. Okay, another one we have is pneumonia. Major clinical manifestations, increased temperature, chills, cough, productive cough of purulent or rusty sputum. We have crackles, wheezes, dyspnea, chest pain, tachypnea, and increased secretions. So treatment is promote full aeration of lungs by positioning in semi-Fowler's or Fowler's position. So para makaginhawa og tarong ang patient. Administer O2 as ordered. Maintain fluid status. Administer antibiotics on basis of sputum culture and sensitivity. Again, depending on the doctor's order. Administer expectorants and analgesics as ordered. Then chest physiotherapy. Then preventive nursing interventions. So you turn the patient to sides, coughing and deep breathing exercises, frequent position changes, and early ambulation. That is how you prevent pneumonia on the post-op patients. Next, atelectasis. Okay. Atelectasis is a complete or partial collapse of the entire lung or area or lobe lung sa lungs. So the major clinical manifestations are decreased lung sound over the affected area, dyspnea, cyanosis, crackles, restlessness, apprehension, fever, and tachypnea as well. So as you can see in the picture, nag-collapse nga part sa lungs sa patient. So treatment, position in semi-Fowler's or Fowler's position. Administer O2 as ordered, maintain hydration, administer analgesics as ordered, chest physiotherapy, suctioning, and administer bronchodilators and mucolytics via a nebulizer. Preventive nursing interventions, so early ambulation, turn to sites, cough and deep breathing, and the use of incentive spirometry. Next, paralytic ileus. So I have discussed this a while ago. Major clinical manifestations, absent bowel sounds, no passage of flatus or feces, and abdominal distension. Treatment, so nasogastric suctioning, IV fluids, rectal tube, and ambulate. Preventive nursing interventions, early ambulation, abdominal tightening exercises, keep NPO if inactive bowel sound. So again, if paralytic ileus in patient, then you tell the doctor immediately. Then bowel obstruction. So manifestations is similar to paralytic ileus, although bowel movement may occur before the obstruction. Treatment. So bowel decompression with a Miller-Abbott tube and a surgical correction. The next, pulmonary embolism. So, manifestations are dyspnea, mulisod gina siya ginhawa, no? Sudden severe chest pain or tightness, cough, pallor or cyanosis, increased respirations, tachycardia, anxiety, bradycardia, hypotension, and restlessness. So, there is an emboli, no? Sa lungs sa patient. So, maski asa ni siya padulong ko asa siya, mulusot or makalusot. And then treatment, so you contact physician immediately. Maintain bed rest with HOB in semi-Fowler's position or the head of the bed. Then maintain fluid balance. Administer O2 as ordered. Anticoagulants and analgesics as ordered. So preventive nursing interventions, passive and active range of motion exercises to legs, anti-embolic stockings, low-dose heparin administration if uh, predisposing factors are present, and then early ambulation. So early ambulation good makaprevent kini siya sa mga post-op complications. Next, hematoma. So, manifestations are active bleeding and elevation and discoloration of the wound edges. So, na hematoma dito ni mga blood clots dito nga nag-surround sa certain areas sa body sa patient. Treatment, if small, may reabsorb, but otherwise, surgical evacuation. Hypovolemic shock. So, manifestations are decreased blood pressure, cold clammy skin, weak rapid thready pulse, deep and rapid respirations, decreased urinary output, and thirst as well, apprehension, and restlessness. So the treatments are you position the patient flat with legs elevated 45 degrees angle, administer fluid resuscitation as well as whole blood or its components as ordered, then administer O2 as ordered, then place extra covering to maintain warmth, and then you prepare for OR. Kay isulod balik ang patient sa OR. Next, thrombophlebitis. So manifestations are pain and cramping in the calf. So bagtak sa patient of the involved extremity, usually. So redness, swelling in the affected area of the involved extremity, increased temperature of the involved extremity, and also increase in diameter. So this is an example of a thrombophlebitis sa, I think, left part sa patient. So this is an example of your thrombophlebitis. So treatment, you administer analgesics as ordered, measure the bilateral cuff or thigh circumferences, administer anticoagulants as ordered, elevate affected extremity to the heart level. Okay? So pahigda ang patient. Maintain bed rest and apply moist heat on affected extremity as ordered. So the preventive nursing interventions are anti-embolic stockings or sequential pneumatic compression stockings, post-operative leg exercises, and early ambulation. Okay, so OR nurses, no, since they are prone to kanang standing for longer duration or longer hours, so we usually use anti-embolic stockings or compression stockings para to prevent thrombophlebitis. So that's it, no? So if you are done kanang as the recovery room nurse, you are done with the monitoring the patient for like how many hours? Usually, depending na sa hospital policy, no? But usually, 2 hours gina siya dapat. If unstable pa ang patient, then you extend to 3 hours or 4 hours, depende na sa stability sa patient. But you make sure that when endorsing the patient, stable na siya. Okay, so medyo malihok-lihok na niya yung extremities, although not very high, but at least malihok niya. So the score should be between 7 to 8, yung Aldrich scoring. Ayan ninyo, i-discharge ang patient from the PACU or recovery room back to his room or ma-discharge na siya. Okay, so that's it for the post-operative phase. So if you have any questions, please comment together with this video or PowerPoint presentation with video. Thank you so much.